So just some general considerations with Parkinsonism and how that may or may not affect your movement quality. You may suffer from slower or smaller movements, which we'll coin as bradykinesia. Difficulty starting or stopping movement, which sometimes gets lumped with bradykinesia. We'll also call that akinesia, or the lack of movement. Stiffness or rigidity, which has been discussed pretty thoroughly to this point. Dr. Boyce mentioned a lot about botulinum toxin and managing dystonia. Muscle cramping or spasm, which for some of you in the room who I'm familiar with, I know that this is a limitation when it comes to physical exercise. And then this bottom point reads freezing of gait. So freezing of gait is not unique to Parkinson's disease. There are other conditions that also present with this sort of special issue when it comes to starting walking or turning or crossing between rooms. And we'll talk a bit about that as we move forward. Okay, so means of improving your mobility. So there are 2 points up here: exercise and physical activity. I wouldn't be doing my job if I didn't explain that those are 2 very distinct physical sort of performance aspects. Exercise should have a specific prescription to it, so it was provided by a therapist. You received that? Okay, cool. Thanks. So it would help if I turned it on. There we go. Cool. So I'm struggling after lunch also. So exercise is there to address a specific impairment or deviation. For example, you're having a hard time rising from a chair due to muscle weakness. So we provide specific muscle strengthening exercises to work on that task. Physical activity includes things like walking the dog or gardening, or the things that bring you joy and help maintain the gains you've made in therapy. So that's one of the most frustrating conversations when we check in on someone's home exercises and we say, have you been exercising? Well, yeah, I've been walking the dog. Walking the dog is great and the dog needs to go, but that's not actually exercise in and of itself. These points here, carry over to both exercise and physical activity, though, in that they can improve your endurance. So, for example, if you walk the dog and you try and walk a little bit further every day, you're going to address some endurance concerns. But through physical exercise and a treadmill training program or an upper arm bike program, you may actually improve your endurance more effectively. You want to increase muscle strength and power so that you can perform explosive movements or functional movements, like standing up from a chair or taking a large step over an obstacle, or just taking a large step to move with more efficiency and safety. We want to improve cardiovascular endurance, and we haven't touched upon it too much today, but one of the biggest complaints which I field from patients living with Parkinsonism is that orthostasis, or drop in blood pressure with quick and sudden movement changes. So there's been a lot of research recently that talks about the use of progressive resistance exercise training, so strength training with weights, to improve your cardiovascular response to these positional changes. So for those of you that have worked with me in therapy, your complaint might be that you're getting lightheaded, and my complaint is you're not strong enough. We're actually addressing the same goal. It's just through a different exercise than you may have expected. And then the fourth and final point up there is to loosen up muscles and tight joints. So we can provide a specific stretching routine to manage just standard muscle tightness, or we can provide specialty interventions for management of dystonia and rigidity that ultimately allow you to do more enjoyable things with your physical activity or just move more efficiently on a day-to-day basis. So I'm going to talk about each of those points moving forward. But again, just to differentiate, exercise, there's specific regimens to improve specific problems. So I mentioned muscle strength, but balance, gait, flexibility. If you're having specific issues with those, it's best to see a provider who can address them. Physical activity is any movement that uses energy. So I've already touched upon walking the dog, gardening. I mean, even hiking. Hiking can be very rigorous, but it's not necessarily seen as exercise from my perspective. I love it. I wish more people did it. But specific exercises for Parkinsonism are going to look a little bit different than a hiking weekend. I'm getting ready to go on one of those for my anniversary trip, so that's why it's on this slide. Now, physical activity is necessary to maintain gains made through exercise, The key point between those final bullets would be that exercise is often supervised by a professional, and it doesn't have to be a therapist. So a number of you here participate in a Rocksteady boxing program, which is supervised. You have an instructor making specific progressions or recommending certain movements. Physical activity is seen as more of an independent activity, though you can exercise independently. So I don't want that to be the sticking point here. Why are we doing all this? So I have another 2-hour talk somewhere that talks about neuroplasticity. This is the brain voodoo when I go out and support groups who haven't heard this word before. So the formal definition is the ability of the brain to form and reorganize synaptic connections, especially in response to learning or experience or following injury. The idea that you're not only exercising to improve your muscle strength, your flexibility, you are actually making brain change. You're strengthening that neuromuscular connection, you're creating new connections, you're more effectively using the connections that you already have. The idea that if you don't use something, you lose it, or use it and improve it. These are some principles of neuroplasticity that your therapy team or your fitness instructors, they're utilizing, maybe without explaining it in these terms. So we're going to exercise specific to the deficits. We're going to improve your availability, in the case of Parkinson's disease or Parkinsonism, to use your available dopamine. So exercising in and of itself does not make you release more dopamine than if you did not exercise, but you're going to better utilize what's in your system. And some of you might be taking a dopaminergic drug that kind of boosts what is available, something like carbidopa, levodopa through Sinemet or Rytary. Taking that medication by itself is great, but it's really just there to help you exercise better and then make more neuroplastic changes through the activity. So the medication is there to help the exercise. I've waited till a number of the neurologists left the room to say that, but I think they would support me that it's not just about medication, it's what do you do after you take your medicine. So neuroplasticity is all about practicing to learn new skills or relearn lost skills. So for some folks in the room, standing up from a chair is something you did for 50 to 70 to 80 years successfully, and now you're struggling with it. I can teach you how to stand up again, or if it's a new skill that you haven't done yet and you're interested in learning it, that new skill might be how do you manage a walker in crowded spaces. I can teach you new tricks too. There's no limit to a dog and the tricks it can learn. I've been given that excuse plenty of times, so I'm just throwing it out there. So regardless of your age or your condition, you are exercising for brain change. The problem with seeing a specialist for management of Parkinsonism is a lot of these treatment paradigms or treatment strategies fail. And that's that we fail you, and sometimes you fail yourselves, and I have to put that out there also. But if it comes to my exercise prescription or my peers' exercise prescriptions, oftentimes they don't lack the necessary repetition or frequency. So how often are you doing the exercise? How many times are you doing it within an exercise session? Oftentimes it also lacks the intensity, and this is the one that's highlighted most in research regarding physical exercise. So how challenging is it both physically and mentally? It's not necessarily challenging you enough to make these brain-driven changes if you can do a crossword puzzle and talk to your grandkids while you're doing your strength exercises. So a number of you that have worked with me in therapy might say that I'm pushing you to do things you haven't done since you were my age, and that's all well and good. I'm pushing you to an intensity that is actually challenging you on both a physical and mental level. They might lack specificity. So is this what you truly need? There's no cookbook where one size fits all. There's no cookie cutter template that you have this condition, you do these 4 exercises, bam, you're good to go. Everybody has their unique presentation and unique needs relative to their function. This next one, salience. So if it lacks salience, that means that it doesn't necessarily matter as much to you. It's not a topic or an activity that you're very interested in. So when you're engaged, if you say that you miss dancing and we practice dancing within a session, you're probably going to pay attention and learn more than if you say, I like dancing, okay, well I'm going to take you out and we're going to practice golf swing. A lot of those same movements are occurring, whether you want to admit it or not, but it doesn't just engage you the same way. So we got to find a way to come to a common ground where it's something you want to do and I want you to do it. A lot of mind tricks and party tricks in managing Parkinsonism. I want you to feel like you're picking it, but really we're coming to a joint decision to do an exercise. And then this final point, lacking variability. Does it change regularly? So there are a number of programs out there for Parkinsonism, or patients with Parkinsonism, where it's the same sort of 5 to 7 exercises that are done maybe every day, twice a day, indefinitely. To me, that sounds like I might get sick of it kind of quickly, because I like change. I have some attention and focus issues myself. I can't do the same thing over and over. Maybe the same general idea with that exercise or that treatment, but there needs to be a little switch, because if you get into a routine where the routine is the same exercises without increasing the challenge, it's not going to be making these same changes as if we did a new exercise with new challenges and new physical limitations every few weeks or maybe every session. So again, it takes a lot to build an exercise program for somebody. You need to reach out to someone who wants you to be the center of your care, like I discussed before lunch, but also who understands how to use these principles in picking your exercises. So as far as exercise programming, if we're looking at flexibility, every patient, every person should be stretching to some degree every day. I try and start folks with 10 to 15 minutes to prevent postural changes. So it's really hard for me to teach you to run, skip, and jump if you've developed some of these colic positions with your head or your back is stiff and you're having a hard time rotating. Stretching is key, and that's why I've listed it first. Aerobic exercise, so we want to improve endurance and heart health. Progressive resistance training, so we've already talked a little bit about the cardiovascular benefit, but it's also going to help improve your movement quality and overall strength. And then that fourth point, amplitude and brain games. So I never want you to feel like you're just exercising your muscles. We're always trying to do some sort of cognitive component. So flexibility, the picture on the right demonstrates a typical upper cross syndrome, as we would describe it, the forward head, rounded shoulders. So we want to stretch the tight muscles and we want to strengthen the weakened muscles. So it's a pretty general strengthening approach that we can take there, strengthening the muscles of the back to try and pull you up. But then we have to teach you to hold this position through attention and those brain games mentioned earlier. And then with your movements, normal walking requires specific ranges of motion. So to have a normal gait pattern, your hip must flex a certain amount, your knee must flex a certain amount, and so on. If you've lost those motions, your body has to adapt and compensate. I want you to recover normal function whenever possible, and compensating is the silver medal. So we're going to shoot for normal function and then take a step back and compensate with what we have available. So the bottom point just says maybe holding stretches for 20 to 30 seconds, up to 3 times, 1 to 2 times per day. Again, just a very general starting point. For aerobic exercise, everything is based on perceived exertion. So what I prescribe for one person doesn't fit for the other. It's how hard are you working. So there's a scale on the right from 0 to 10, 0 being no effort or no energy expenditure, to 10 being very, very heavy work. Well, my goal for many of these exercises is a 3 to a 7, so a moderate to a very heavy intensity. Depends what we're doing. If it's a short burst, like for some of you standing up might be very challenging, for some of you walking short distances might be very challenging, though the effort might be higher there than if we're doing a seated strengthening program. But you have to be hitting both moderate and high intensity interspersed through your training programs. Progressive resistance exercise training is the next point. So strength training is also based on perceived exertion. My 1 repetition maximum, I would hope, is very different than my mom's 1 repetition maximum or your 1 repetition max. Mine might be to lift a weight, yours might be to lift your body. So we have to identify what is your 1 rep max or what is your theoretical 1 rep max and program based off of that percentage. So we're trying to work with varying set and repetition schemes. When I work with a number of PT students, they all come out doing 3 sets of 10 of everything. I get away from that very quickly. So we'll typically work in 5 sets of 5 more challenging repetitions if we're trying to produce power output to manage bradykinesia. We might do lighter repetitions if it's for general endurance, like shoulder strengthening exercises. And then it's compound functional movements like squatting, lifting from the floor, performing a sit to stand, or pressing something overhead. Now my final point, again, this could be its own lecture, the idea of training amplitude and brain games. Not just does your body have the ability to do the movement, but can you do it automatically? Does it happen without much mental effort? So we're trying to recalibrate your perception of normal movement. Many of you might not have realized that your arm wasn't swinging as well as the opposite side, or that your steps were getting shorter, or that your posture had changed, because your body's ability to perceive that has been altered. So we need to teach you, this is what normal looks like, this is what normal feels like, and train you in that aspect. So if it feels normal, a lot of therapists will tell you it's not big enough. Normal for you might be dampened or smaller, so we want to teach you to kind of burst out of that. And the idea of brain games, I wrote on here to utilize dual task training and attention training. So can you walk, talk, and chew bubblegum? The speech therapist in the back probably doesn't want you to chew bubblegum while you walk, and that's fair. But can I get you to attend to 2 or 3 things at a time? So if you're able to do that effectively, you're less at risk for falls, and you have a better long-term outlook on your prognosis. So exercise should incorporate a thinking component to some extent. So just an overview here because I overstepped by a few minutes. No apologies there. Daily exercise needs to have various components, and it must be mixed up. So you don't want to do the same thing every time. This general outline here suggests up to or over an hour. So flexibility, 10 to 15 minutes. Aerobic exercise, 20 to 30 minutes. Progressive resistance training, 20 to 30 minutes. And amplitude and brain games, 10 to 15 minutes. I even put on there that you can incorporate it with your flexibility. So that's what I myself do. I try to not play games on my phone unless I'm actively stretching, or else I'm just wasting my time on my phone. But if I'm stretching my hamstrings while I'm checking my email, then it makes me feel a little bit more productive. So you guys can find ways to incorporate that too. How do you do your exercises without making it feel like exercise? So my take home here would be to meet with healthcare professionals for an initial prescription, seek out specialty care, and then go out into the wild and see, are you able to manage this with family or just your own independence at a gym or in the home? If you need more supervised care, it's always available to you. And then check in regularly. So the exercises I gave you in September, well, it's April now. Your needs have probably changed. Hopefully everything is going perfectly. You're stronger, fitter, faster. You've actually staved off disease progression from a functional perspective. Okay, well now it's time to make it harder. How do I take you to the next step with your exercises? Or if disease progression has led to some new functional changes, how do I address them before they become a bigger issue? So just like you're checking with your neurologist every set few months, I would recommend checking in with physical, occupational, and fitness professionals regularly just so someone else can have eyes on you. Because these exercises are specific to your needs and no one else's. Thank you.